CVS Health, one of the largest U.S. pharmacy retailers, has held high-level talks about a combination with health insurer Aetna, which would create one of the most powerful forces in the prescription drugs industry. The talks come at a time of potentially tectonic shifts in the pharmacy industry, which is abuzz with rumors that Amazon plans to enter the sector. Earlier on Thursday, it emerged the retail giant had received wholesale licenses from at least 12 U.S. state pharmacy boards. However, CVS and Aetna have been exploring a number of deals throughout the industry in recent months, and there is no certainty anything will come of the discussions after premature revelations. CVS is working with bankers at Evercore Partners and Barclays, while Aetna is working with Lazard. A CVS-Aetna deal would combine the third-largest health insurer in the U.S. with the two planks of CVS's business, a pharmacy benefits manager, PBM, that negotiates the prices of medicines with pharma groups, and the country's biggest drugstore chain with almost 10,000 stores. Investors sold off shares in PBMs, drugstore chains and pharmaceuticals wholesalers on the speculation of a possible deal and the Amazon move, with Express Scripts, Walgreens, Rite Aid, and McKesson shedding between 3 and 6%. Shares in Aetna jumped by 12%, giving the company a market capitalization of almost $60 billion, while CVS lost around 3%, putting its stock market value at $74.5 billion. Some other insurers also have an integrated model that combines an insurer with a PBM, such as United Health, which cuts deals with drug makers through its Optumrx division, and a consortium of Blue Cross Blue Shield state health plans, which negotiate via Prime Therapeutics. Anthem, the second-largest health insurer, also entered the PBM sector recently by launching a new operator called IngenioRx. But a CVS-Aetna deal would stand out if consummated because it combines a large drugstore chain with an insurer for the first time, and also because it would put the pharmacy group, rather than the insurer, in pole position. One analyst, who asked not to be named, said they view the talks as a direct response to fears that Amazon plans to enter the pharmaceuticals industry by selling drugs online, setting up a PBM, or doing both. Although the licenses Amazon has applied for do not necessarily mean the company plans to sell prescription drugs, the company has hired several executives and managers from the healthcare industry in recent months. CVS and Aetna declined to comment on what they described as rumors and speculation. The talks were first reported by the Wall Street Journal. It is far from clear that the CVS-Aetna combination would be approved by regulators. The Department of Justice recently torpedoed a tie-up between Cigna and Anthem as well as Aetna's takeover of Humana, warning that both transactions would harm consumers by reducing competition. However, CVS and Aetna could present a deal as consumer-friendly because the combined company would potentially be able to extract better deals from drug makers and help to contain the soaring price of medicines, according to one person briefed on the company's plans. President Donald Trump has described the prices charged for drugs by pharmaceutical groups as tantamount to getting away with murder. Drug makers already say that PBMs, insurers, and wholesalers are collaborating in ways that is hurting their margins, and generic drug makers such as Teva and Mylan have blamed more powerful customers for price deflation that is roiling the industry.